This is a video of a patient in his 30s with expansile mass in the frontal sinus extending into the orbit with proptosis on the right side. These are axial images showing dehiscence along the floor of the right frontal sinus. You'll see the dehiscence is actually located along the lateral aspect of the right frontal sinus, with a density extending down into the orbital contents, causing the proptosis. I'd like to point out the piezo device, which is used to make the osteotomy. This is a modified brow incision that allowed us to create a customized tailored window in order to access the lateral aspect of the frontal sinus. The edges of the cut are so sharp, it's similar to a 15 blade, but on the bone. This allows us to be able to avoid using any hardware at the end for the closure. The pathology turned out to be a cholesteatoma of the frontal sinus. Initially, it was thought to be allergic fungal sinusitis. It was obviously super infected. This is the orbital dehiscence area. Evacuation of the disease. With this modified brow incision and the osteotomy, it allows us to avoid use of a bifrontal bicoronal incision and allowed us to save approximately an hour of time. Total case duration was approximately an hour and a half. Visualization was assisted with endoscopic access using a 4mm rigid scope, which can often be used on a scope holder, including the Mitaka scope holder. This is the conclusion. You just basically drop the piece of bone in there, and ultimately this is a 3-month follow-up showing almost complete resolution of and evacuation of the disease.